Dr. Decker is an associate professor in the Department of Population, Family, and Reproductive Health here at the Bloomberg School of Public Health with a joint appointment in the School of Nursing. She also directs the Women's Health and Rights Program of the Center for Public Health and Human Rights. Dr. Decker is a social epidemiologist by training, and her research focuses on various forms of gender-based violence, its prevention, and its implications on sexual and reproductive health. Much of her work involves marginalized populations, including urban women, adolescents, and those involved in transactional sex or sex work. Her work includes clinic-based intervention efforts to mitigate the health consequences of violence, as well as primary research to understand the mechanisms by which violence influences sexual health and HIV risk. She works domestically, as well as in South and Southeast Asia, and in Eastern Europe and Central Asia. Please welcome Dr. Decker.
Thank you very much. I'm delighted to be here. This is always a pleasure to speak to this audience. Hopefully I'm standing in the right spot here. I tend to be a mover, so we'll see how I do with this. Thank you for that wonderful introduction. I want to give you just a little bit of background on myself beyond sort of my current work and my current role. I really came into this field really as a rape crisis advocate. Way before I even did MPH work, et cetera, I was working in crisis, very direct crisis response for issues of sexual violence and intimate partner violence. It got me really interested. Seeing people come through our emergency departments, seeing people come through our crisis hotlines got me really interested in prevention and response to violence. So you'll hear some of that coming out, I think, through the talk. And the other piece that I think is relevant, especially for you all, is some of the policy hats that I have worn, including working at the state health department level to monitor response to sexual violence and intimate partner violence, as well as strengthen sort of technical support, but also evaluation systems around violence. So many of the things that we're going to be talking about today are around accessing justice and support services, and with our public health professional hats on, we're always wondering, okay, how can we get more people into the programs that we've put in place for people, right? And what are the indicators of success? How do we know that we're doing a good job in overcoming some of these barriers to justice and support services? So I'll just invite you to kind of keep your eyes attuned to that as we go through, and we can have some time for discussion at the end as well. So we're going to talk today about GBV and access to justice and support services, heavily US-based. I'll give some examples from international settings as well. And I'll give you an orientation to the topic first before we jump into access to justice and support services. Here I offer you a definition from our U.S. strategy to prevent and respond to gender-based violence globally. This is actually under the Obama administration. I'm not sure if this is still available on our State Department website. But what I will call your attention to is that gender-based violence means violence that is directed at an individual based on his or her biological sex, gender identity, or perceived adherence to socially defined norms of masculinity and femininity. This is a real earth-shattering advancement here in 2012, right? So historically, our policy frameworks internationally and domestically have been very focused on violence against women specifically, and this is really opening up a new era, truly, where we're able to see marginalized populations, especially groups that are marginalized on the basis of gender identity. Okay, so this is inclusive of physical, sexual, and psychological abuse, threats, coercion, arbitrary deprivation of liberty, economic deprivation, and really critically, this is whether occurring in public or private life, right? And these definitions harken back to UN conventions, and they harken back as well to an era where domestic violence in particular was often sort of swept under the carpet, right? Something that occurs in private, so we don't need to be concerned about it. And so this distinction here and this inclusive umbrella tells us even if it's happening at home, it is our responsibility as public health practitioners and so on to be addressing gender-based violence. So what are we looking at globally? People, and I see a couple people that are very up in the violence field in this room, so we can benefit from their input throughout the discussion. But what we see globally from the World Health Organization is that about 1 in 3 women throughout the world experience physical and or sexual violence by a partner, so intimate partner violence, or sexual violence by a non-partner. And you can see there's a little bit of variation, regionally as well, but in no region are we seeing very low numbers, right? So the lowest is around 20%, 22%, right? Right here in the United States, it's about 1 in 3 or 1 in 4 women. And what we've learned over time, globally and domestically, is that intimate partners are really the primary perpetrators of violence against women. So many of you, when you were growing up, may have been exposed to sort of safety strategies, kind of stranger danger. And really what we've seen in the research in the US and globally again is that known perpetrators are really responsible for the majority of violence that's perpetrated against individuals. And for women in particular, it's intimate partners. Husbands, ex-husbands, boyfriends, dating partners, et cetera, especially when we're talking about our adolescent populations. So oftentimes in public health, we're setting out the facts, right? And we're reminding people that the violence that we're seeing is very often perpetrated, again, by those known perpetrators. I just want to call attention to homicide in particular as a very distinct outcome and a very severe outcome for the violence that we're going to be talking about today. A very recent global review of homicides showed that about 1/3 of female homicides were committed by an intimate partner. I didn't give you the data from the men, but it's the proportion is much less for men. And in Maryland, actually, this is always interesting to me from my departmental home in population, family, and reproductive health, is that homicide is actually the leading cause of pregnancy-associated death. And these are some data from our colleagues over at the State Health Department. So again, very much tied up with women's health. And at this pivotal time in life, oftentimes, during the childbearing years, as young as adolescence, and that tends to be really when we're seeing these peaks of violence. So let's take a quick look at some of the U.S. data. And so this is what we're seeing is intimate partner violence among U.S. women. This is from our national NISVIS, National Intimate Partner Violence and Sexual Violence Survey from CDC. And what we see is that about lifetime prevalence of physical violence for women, this was about 1 in 3 women, again, similar to what we see globally. And this is, sexual violence was a little bit less common. We see that about almost 1 in 10 women are reporting some form of sexual violence, rape within that intimate partner relationship. When we add all 3 together and include stalking, we're not getting tremendously much more beyond our baseline prevalence of physical violence. So you can see there's quite a bit of overlap among these categories. And what's really noticeable here as well is the impact. So there was a set of questions that asked, if you've had any of these experiences, what else are you experiencing? Have you been fearful for safety? Any PTSD symptoms? You can see a long list here at the bottom, missing days of work or school. And overall in the population, just over 1 in 4 women, 28%, reported that, yes, they had partner violence and it really had an impact on their life in one of these dimensions, okay? So we know that this is happening, and we also know that it is really creating some impact. Why is that important? It's because sometimes when we're talking about violence or in various audiences, people are concerned that, oh, maybe there was some harsh verbal language in a relationship. Maybe there was something that we could write off as not very harmful. And these data are telling us that this actually is pretty harmful. There's some people that are experiencing violence without reporting some harm, but by and large, this violence that's being experienced by women is creating some harm. Okay. I'd like to also share a little bit of what we know about youth and young adults. And here what we're seeing is we're asking women, well, if you've had experiences of partner violence, when did that start? What was the age at onset, right? And there's been, again, sort of this assumption over time that this is a problem that might be experienced in the middle of life, maybe early in marriage, et cetera. But here these data confirmed some of the reports that we're hearing from high school students or high school samples that actually the age of onset is quite young. So we see that about 1 in 5 people that have had this experience, this actually initiated from 11 to 17, sort of our classic school age bracket here. And then 18 to 24, obviously a tremendous age at onset. And this is when people may be leaving home for the first time. They may be away from their social support networks. They may be in relationships potentially for the first time. And this is a vulnerable time for people. And then you can see other people are having an age at onset that's a little bit older. But this is very startling for us, and it really sort of harkens to the need for prevention policies and also response policies in our middle schools even, and certainly within our high schools in the U.S. certainly. I always look at these and I really wish that they had split this up a little bit further so we could see that distinction maybe at 14, maybe 13 or 14 to tell us how much should we be investing in middle schools versus high schools and so on. And again, this age bracket is tremendously important. So I encourage you when you move forward, as you think about violence and violence against women, gender-based violence, think about this really truly as an adolescence and young adult issue, as well as a general population issue. And finally, I'm giving you just a couple key slides here. I encourage you, if you're interested, take a look at the NSFS report. It's very informative, and it really goes into detail on gender differences, age differences, etc. But I do just want to call your attention to a couple things here. One is that a gender difference in severity of violence. So we did also ask men on this survey about experiences of partner violence. And we saw that the prevalence was rather comparable. The impact was felt much more by women. And then when we look at the severity data, we see that among those victims, about 1 in 4 women had experienced severe violence from a partner, and 1 in 7 men had experienced that. And that's being hit with a fist, something hard, slammed into something at some point in their life. So we see a gender disparity here. And we also see some needs for men, right? We see that men are experiencing violence in a way that we haven't always acknowledged or that we haven't always prioritized in terms of prevention. So this is just a couple of points that often come up when we're talking and thinking about violence and who do we really need to be targeting for prevention and access to care. Okay. I gave you this slide on sexual violence, also from the NSFS, really for this particular component. Around 1 in 5 women and 1 in 71 men in the U.S. have been raped at some point in their lives. And you can see, if you're interested in taking a look at the forms of sexual violence and the definitions of rape as well as sexual coercion, you can take a look into some of the details around that. What we tend to find for those of us that have done crisis work, we tend to find that experiences meeting sort of a forced definition of rape are more rare than pressure or coercion, first of all. And it makes it hard for people sometimes to report experiences of sexual coercion or pressure, right? So as a rape crisis counselor, what did that mean for me? It meant that a lot of my hotline calls were people that said, I wasn't raped, but, right? I don't think that I was raped. I don't think that there was force involved, but something happened and I wasn't comfortable, and I think that I may need some help or care. Many people are calling to find out what do they need, what is available for them. And so I give you this in part so that you can have that distinction in your mind, whether for your own work or when you're out in the community or having conversations about violence, just to be really aware that people often minimize experiences that they may have had. And it can be very, very hard in an era where we see sort of, again, sort of classic stranger danger promoted on, television or Lifetime television or what have you, really making space for non-forcible instances that really do constitute sexual assault is really, 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 really important, especially in a culture that tends to minimize survivors and minimize people that are reporting violence. All right. So what do we do? What do we do about violence? I generally use the sort of 3 pillars framework that the U.S. government has sort of promoted, as well as Pop Council, other leaders in this space. And this is a comprehensive response. I want to give you this bigger framework before we jump into justice and services. And the prevention pillar is pretty self-evident, right? Reduce the incidence of violence, right? Reduce sexual violence, reduce intimate partner violence. Equally important for us, really, though, especially with our public health hats on, is that response. So if we haven't prevented violence, what can we do to prevent some of the unintended health outcomes, unintended pregnancy, STI potentially, promote mental health among our survivors of violence? How can we get people connected to care that's going to allow them to live as fully as they possibly can? So that's really the health sector response. And then the prosecution piece is around accountability, and that's where the justice piece comes in. So how can we hold perpetrators accountable and hopefully end a culture that really allows violence to continue with impunity? So those are the sort of the three bins that we tend to think of this in. And I'm really going to heavily focus on sort of this access to justice piece, as well as mitigate that health and social impact, get people connected to our support services. Okay. So before you look at this slide, think about what you think about when you might think about a crisis hotline for domestic violence or sexual violence. What pops in your mind? Be careful moving. Be careful moving. I'll call on you. Does anyone have a picture of what some of those services are? What do you think about? Yeah.
I know like the YWCA, it's like women, you have to be trained to do it, and they just like ask you to talk, you don't ask identifying information, just try to keep the person on the phone for as long as possible until you feel like they've truly calmed down and
Okay.
said everything you need to.
Okay, so really a crisis response. Keeping people on the phone, I'm just going to repeat it for the recording. Keeping people on the phone until people have calmed down and really providing that instant sort of crisis response. Yeah.
I think legal services to help women or men
Yeah.
safe and protect them against whoever it is.
Absolutely. Legal services, connection to legal advocacy. Absolutely. Yep. Yeah.
Also, like, providing information about options and, like, next steps, and so, like, if
Mhm.
a rape has happened, like,
Yep.
get to the hospital, see your rape kit, and, like, just informing their options.
Exactly. Right. So providing options. I love these responses. Providing options, giving people education about what might be available, a rape kit, which is a forensic evidence collection, right? Connecting people with immediate sort of crisis care. Okay, I think I saw one other. Someone else have a hand up over there? Okay.
I think one thing that's important is also validating what they're feeling. That way they kind of know that, it's real and it's not something
Yeah.
that's all in my head.
Yeah, right. So validation, providing sort of a non-judgmental, supportive voice that really allows people to process their feelings, and that crisis call might be the only person that believes somebody that has had an experience of violence, right? So these are, thank you, that's great. We've hit on a lot of these. We obviously, some of the first things that came up, I think, in this conversation were around crisis intervention. So getting people from a crisis stage to a more stabilized state. Safety planning, we heard about medical and legal police advocacy, et cetera. Some of the counseling. Some of people often think, especially for partner violence, people think immediately of sort of that emergency housing that people may need, right? So a lot of these are in the crisis bin, right? And what often people are less aware of is sort of that ongoing support that can be provided. These can be support groups. These can be, one-on-one counseling. It can be on a crisis hotline or it can be on an appointment basis. And really, this is part of our comprehensive response so that once the crisis has passed, people are still able to get that connection to care. They may need more long-term types of support, such as legal services, medical services, transitional housing. People aren't always ready to leave a situation of violence, right? So they may need some safety planning in advance of that. Their needs may be crisis-oriented, but they may not be. Why are we talking about this? Because some of the less crisis-oriented services are just less on people's minds, I think, when they think about violence. And many of our women come to us or survivors come to us and they say, gosh, I didn't know that I could call if I wasn't in crisis or if I didn't need emergency housing, et cetera. So raising awareness about the totality of services that are available is really, really important, so that people know that even though that experience was, 2 years ago or 5 years ago, they may still be having some lingering mental health symptoms, right? They may still be having some support needs, whether it's for counseling or even some medical kinds of care. Those are resources that we can support through our rape crisis and domestic violence programs. It's something for all of us to really be aware of in terms of support for survivors. So we're going to sort of jump global in terms of who do people share experiences of abuse with. These are some data from the World Health Organization multi-country study. This was one of our very first cross-national efforts to look at experiences of violence and access to justice and care for survivors. And I hope you guys can see that in the back, but what I'll summarize here very quickly is that most people, here in the blue is the bar that's telling us people actually didn't tell anybody at all that they'd had an experience of partner violence. You see family members in the light blue, friends and neighbors in the dark black here. And then services and authorities are in this gray, right? And so you can pretty quickly, even if you can't quite squint to see Japan City and Peru City and so forth, you can pretty quickly see that this gray is the lowest category for most of these groups, right? Some people, in some settings, people really didn't tell anyone at all. In other settings, they relied, actually this is an example of where they actually did tell the services, but you can see that in many cases, people are relying on that informal network much more than they're actually reaching out for services and care. So how do we feel about that in public health? We feel great if their informal networks are meeting their needs, right? But what we're always very concerned about is if people do have lingering needs, we want to help them make that connection. So if you needed the care, and you needed the validation and you got it from your friend or your family member, super. If you don't have unmet needs, that's wonderful. But if you do have unmet needs, we want to make sure that we're reducing the barrier to accessing social support services as well as justice in terms of police reporting. Okay. So just a couple, I love these snapshots, and I encourage you, if you're interested in this, to take a look at this World Health Organization report, because they did a really nice job sort of synthesizing some of the main reasons that women do and do not seek help for violence, situations of partner violence or sexual violence. Let's take a quick look first for the people that didn't seek help. Many of the women sort of normalized this experience of violence. They felt like it was so common. Why would I report this? Why would I share this? This is the normative experience in my community. Or they felt that it wasn't serious, okay? Fear of consequences or fear of threats of additional violence is also a real barrier. We hear that around the world. And certainly as well, embarrassment, fear of being blamed or not believed, right? So people, because, and this is sort of coming back to that public or private piece, because sexual violence and intimate partner violence often occurs in the home or in a very isolated setting, we don't always have a lot of witnesses. And so that brings into this question, someone's word against someone else's word. And because we have that, sometimes people are very concerned that they simply will not believed. Add on another layer of being a very young person, add on another layer of having limited social status for some reason, and people are very, very convinced that nobody will take their word. No one will take their word as seriously, right? Fear of bringing shame on a family is another example as well. Some of the reasons that people really do not seek help for abuse. So given this, what does encourage people to seek help? Sometimes it's a question of a tipping point, right? Sometimes it's a question of not being able to endure further violence, being very severely injured. Oftentimes, once children come into the picture, whether a partner is threatening to hit or hurt a child, that's also sort of one of those tipping points where people say, okay, now it's not me anymore. Now I've really got to get help. Now I've got to tell somebody. Now I'm going to sort of take some action steps. And I also draw your attention to this piece around being encouraged by friends or family. Right, so we talked about those informal networks. Hopefully those informal networks are meeting people's needs, right? At times when those informal networks are encouraging people to get additional support, you can see that that's actually really valuable. Those are some of the reasons that people are coming forward for care. So again, with our practitioner hats on, whether or not this is your primary field, you can know that getting people connected, letting people know about the services that are available is a really important step in closing that loop, making sure all of the needs are met. Okay. This is just a couple of other things that sometimes come up around barriers to care seeking. This is actually more U.S. specific. But you can see, again, stigma or shame, fear of retaliation. Here in a U.S. context, people are often very concerned about social services and whether that getting police involved in a situation of partner violence could actually trigger some sort of child protective services process where they would be seen as not fit to parent. Physical and social isolation can be another factor where sort of that learned helplessness or just the isolation factor, not knowing where to reach out. And really importantly, this didn't come up in the WHO report, but it comes up a lot in our work, and that is sort of that belief or hope that the violence will end, right? So this is sort of this question, well, why doesn't she just leave an abusive relationship, right? And when we talk to women, we hear that they don't necessarily want to leave that relationship. They just really want that abuse to end, right? And so leaving is actually not very attractive. The possibility that that relationship would become less abusive is really attractive. And again, lack of awareness of services and lack of recognition of abuse. And that's where people are potentially normalizing their experiences, or they simply see that these are things that are happening to women all around them. It's hard for them to necessarily come out of that to say, oh gosh, I might actually really need some care in this situation. All right. I just want to really highlight some of the disclosure and help-seeking issues that are specific to sexual violence, and I'll flag that this is very heavily dependent on context. I shared earlier that stranger assaults are less common than assaults by known individuals, but they're actually more likely to seek formal support. They're more likely to report to police. They're more likely to share with friends or family members. And by contrast, those that are victimized by sexual violence by a known individual are actually more likely to rely on those informal help sources, if at all. So we tend to miss many of those violence experiences that are perpetrated by maybe partners, maybe friends or acquaintances, etc. So what does this mean for us? It means that generally stranger assaults are overrepresented in police reports, right? So if we're working from a data standpoint with police data, we know that we're getting into there's some biases in what's coming through those police reports. There's some biases in what's coming through our emergency departments, and there's some biases in terms of what's coming in even for rape crisis programs and so forth. And this also tells us that we need to do a better job of reaching out to people that may have had experiences perpetrated by friends or family members, or partners, acquaintances, etc., to let them know these services are available for you too. You don't need to minimize that experience. You can seek this help, and we can support you in that. I've been telling you a lot about support services, so I realized I should tell you a little bit about why these are valuable. I'll spare you the details in terms of the studies that have been done, but what we've seen in general over time is that when people have obtained support for violence experiences, shared that experience in a supportive environment, we actually see some real gains, okay? We see reductions in PTSD symptoms. We see that likely very much some of that validation work that was mentioned, that really buffers against self-blame, right? One of the factors that bubbles into especially for sexual violence, are these questions around, was I at fault somehow, okay? And when we get people connected to care, supportive care, that really reduces that sense of self-blame. Some studies have shown that connection to crisis services can actually also reduce re-victimization, in part potentially through some of these pathways. So it's important for us to know how valuable these services really are. This might be my last. Yep, okay, we're going to jump into justice in a second. But again, our role in public health is really sort of overcoming some of the limited knowledge and lack of awareness about these support services. So communication about service availability and scope is a real priority for public health in the response to violence. Getting people connected to care, obviously only when they need it. If their needs are being met again by some of these informal networks, wonderful, but we want to make sure that people are really getting that connection to care. All right, so that was my quick tour through to support services. I want to talk a little bit about access to justice, and again, we're going to kind of look globally as well as very locally here in the Baltimore area. So there's a lovely report that comes out every year or so that's called Progress of the World's Women. And a couple of years ago, in I think it was 2012 or 2013, they focused specifically on access to justice. And I've copied here one of the best figures from this. And this is showing us that about 2/3 of countries globally have laws in place around domestic violence. So here you see in the blue the legislation that's in place. We see some nice coverage as well for sexual harassment. But we see a real gap here when we're looking at marital rape. So oftentimes there's exemptions around our sexual violence laws if there is a marriage in place, right? And so we've been starting to erode that, but you see that the strength of law is much less when it comes to sexual violence within marriage, okay? But by and large, we do have, and this is, again, sort of progress that we've seen over time, is that about two-thirds of countries have actually criminalized domestic violence. Obviously, you need a strong legal framework in place if there's going to be a justice system response. We can talk separately about other sort of avenues of justice. Okay, and then here in the U.S. we have state-level definitions. We also had some marital rape exemptions. Most of those were lifted in the 70s and the 80s. The last one was lifted in 1993. And we also see differences in severity, sort of differences in the legal framework across states as well. Okay. People are probably familiar with the Violence Against Women Act. Hopefully you are. This is established in 1994. This was in our Clinton administration. Then Senator Joe Biden actually really drafted this legislation. It was really a watershed moment for violence. We established through this our National Domestic Violence Hotline, and really established as well funds, right? Support for those support services. And those were shelter services, crisis services, et cetera, as well as judicial, on the judicial arm, judicial education and outreach. And a lot of this as well focused specifically on rural women. We've seen this has generally gotten bipartisan support for reauthorization. Sometimes issues have come up primarily around all the issues that always come up when we're getting things done here in the U.S., oftentimes around LGBT rights, unfortunately, and some of the issues around immigration and immigrant rights within this. But this is a really strong policy framework because it's at the federal level, and again, it provides that support for support services. So even with this in place, even with knowing that we have laws against domestic violence and that we can bring those police reports, we've seen for a long time that sexual violence and intimate partner violence are among the most underreported crimes, okay? So our National Crime Victimization Survey reveals low reporting, especially for sexual violence. This is about 1 in 4 people are reporting sexual violence, and less than half of people. Now, these are people that have picked up the phone, completed a survey, and told us that they've had an experience of intimate partner violence or sexual violence. So we're already missing probably some people. There may be some biases in that, right? But here we see that only about 44%, less than half of women are reporting intimate partner violence to police when those crimes occurs. Same sets of challenges to what we saw around access to support services, right? Around maybe fear of stigma, fear that people might not be believed, et cetera. We can think about the reasons that it might be hard to make a police report in this case. But we see, did you, something? No. I'm always looking for hands. When I teach, it's very interactive, so I'm always looking for people that are wanting to chime in. So we see very low rates of reporting. Okay, what are some of the reasons? Here you can see some of the reasons for not reporting to police. bisexual violence in the blue, and intimate partner violence in the lighter blue. I'll give you a chance to sort of digest that. Some very interesting trends, especially around, for sexual violence, really feeling that the police wouldn't help in that situation. And we don't know if that is feeling that they wouldn't necessarily be believed, or feeling that there was nothing that could be done from the justice side of things, right? And the other big category that you can see as well is that women felt that they had taken care of that matter privately, especially for intimate partner violence, but also for sexual violence as well. So this is raising a lot of questions for us, right, around this justice response. And I'll just take a pause to tell you that sort of in the field, there's sort of two schools of thought. One is that, gosh, we really want this formal justice avenue for people that have experienced these crimes. We've got to get people comfortable reporting and making those reports so that that system can really function. And then, of course, the other sort of, I'm making big generalizations here, but the other school of thought would suggest that, this is really someone's choice to do. We want to empower people if they're taking care of it privately or they're finding some justice outside of the system, then we really want to support that. And certainly from a victim advocacy framework, we would never mandate that people report. What we do want, though, is we want, again, people that have unmet needs for justice. We want it to be very, very, very easy for them to report. We don't want these barriers. We don't want people feeling that police wouldn't help, fearing reprisal if they make a police report, right? We want to lower the barrier to entry into this justice system. And then people can decide what they want to do. All right, so we're going to get really local. We're going to really look at Baltimore here. A couple of you have seen me present on this. But this is a great case study. So this is a graph of rape reports and you can see that they've been on a steady decline in Baltimore City from about 1992 to 2009. This report came out in 2010. So what do you feel when you see this?
Maybe things are getting better.
Maybe things are getting better. Yeah, maybe we're not having as many rapes in Baltimore City. That would be a good reason for this graph, right? We would celebrate that. What else? Yeah.
Maybe there's a reason they're not reporting to police.
Maybe there's a reason that they're not reporting to police. Okay.
Maybe they don't have the administrative ability to write these reports and send them.
Yeah. Systemic issues, maybe they don't have the administrative capacity to follow up on these. I think I saw one more hand. No?
Potentially changes, well, two things, one more optimistic than the other.
Okay.
It looks like there was a pretty steady drop around 96.
Okay.
So potentially the Violence Against Women Act funds started coming in and helping to provide education on police and judicial, but also there may have been changes in the definition of rape or changes in administrative how rape is categorized by the police or by the FBI.
Right. So there could have been some changes in definitions that may have changed what actually would classify as rape within this, or potentially an optimistic solution, much along these lines, in terms of maybe things are really getting better, especially with the influx of VAWA resources. Okay, so what happened? What happened? At the same time that this came out, one of the major reasons for this decline is actually that Baltimore City was found to have the highest percentage of rape cases that were found to be baseless or dismissed. In fact, about 32% of cases that were reported to police, which we know to be the tip of the iceberg, were determined to be unfounded or baseless, right? So what does that mean? Somebody calls and makes a police report. I tell you that my car was stolen. You find it in my brother's yard. An unfounded case, right? Some portion of crime reported is falsely reported, right? But this would suggest that it was almost 1 in 3, right? Highest in the nation. And you can see that this graph is showing us basically the inverse of what we saw on the previous slide, right? Okay. So this was very troubling, This was very troubling. Okay. And this slide, just for those of you that are taking a look at the all the details and the slides on the other the slide set that was distributed, just gives us a showing of some of the other leading cities that had unfounded rape cases. You can see that Pittsburgh was behind us at almost 30%, Dallas, and they kind of go on down from here. And you see homicide pieces and other, you see this by year as well, right? So this is very, very, very concerning in terms of a justice response to sexual violence, right? Because we know that so few cases are reported, we learned from the National Crime Victimization Survey that only 23% of people that have this experience are getting to that entry point. And then if a third of them are being dismissed and not pursued, that's really a problem for people being able to access justice. All right, so what did the city do? There was a campaign to provide support and outreach and also make that connection to care for sexual assault victims. This is one of my favorite pieces of media from that campaign. It says, "No one will believe me, was it my fault?" Right? So getting at that fear of, I brought this on myself, right? There was also an opportunity for people that had their cases dismissed to call the police and reopen those cases, and also for people who may not have reported because of the bad publicity that was being put forth by the police department. Okay. So there was some auditing that went into place here as well. There was a sexual assault response team that was formed, and they took a look at all of the unfounded cases, which totaled about 98 here. And you can see that some of them were reclassified. Many of them fit criteria for some form of sexual offense. Some were correctly unfounded. 43 out of the 98 were correctly unfounded, and so forth. So really looking at that process to see where do we have administrative gaps, and where do we have cases that somehow, for some reason, really should have been classified as unfounded. Okay. There are, over time, we saw some decreases in the number of unfounded rape and sexual assault offense cases. This came out shortly after that report, so you saw a very swift response on the part of the mayor's office and on the part of the Baltimore City Police Department, and a real reinvigoration of support services and care from the police department for sexual violence victims. Okay. And you can see that over time, this is a later report, but what you can see over time, again, is that the percent of cases that were deemed unfounded has been declining. So this is a real lesson to us, right, for those of us that are working in terms of access to justice, because some of our policy frameworks, I showed you that the National Crime Victimization Survey, and we said, oh my gosh, only 23% of people have reported to the police, right? Many of us would say, okay, that's your entry point to the justice system. We're not going to look further than that, right? And what this is telling us is that actually, with more of an implementation science hat on, we really need to make sure that that system is functioning properly. And really, it's a vigilance question, right? We need to make sure that that system is functioning properly so that all the things that we think are going to happen after that report is made are actually made, right? So that is a piece in the justice system that we don't always think about when we're thinking about access to care. Oh gosh, I need to speed up. I'm keeping an eye on the time here. All right. So by 2017, many of you may have read the Department of Justice, the Federal Department of Justice investigation of Baltimore City. And we saw that even with the changes that were made after the 2010 report, there's still some gaps in accessing services and accessing justice, minimization of abuse, undue skepticism on the part of officers, failure to attempt to corroborate accounts, inappropriate lines of questioning on what behavior may have invited an assault. If you haven't had a chance to read this report, I really encourage you to do that. It's not just about sexual violence, it's about the whole city police department. And And we also have had reports and investigations into unfounded rape cases in the county and some of the surrounding jurisdictions as well. So these are some of our levers. These are some of our policy levers. Before we sort of close and take questions, I just want to give you a very quick insight into all the layers that make it hard for people to access care that we're all working to overcome in public health. And so we'll end with thinking about marginalized and criminalized populations. These are groups that we can think of as high risk and underserved, right? They have factors and experiences that are making it more, they're more vulnerable to violence. And at the same time, they're less able to access justice as well as support services. A couple of them, I do a lot of work with sex workers around these exact topics. We also see these issues for people who use drugs criminalized, right? Behaviors that are criminalized and stigmatized and very much othered, right? Immigrant populations as well, another group that, especially with a lack of legal status in this country or any other country, may be very, very afraid to engage with police on any topic, or even come forward to support services for fear of somehow that getting linked back, okay? So the risks, again, for violence are often greater and compromised ability to access support and justice services. Just a couple of quotes from some of our work here in Baltimore City. This is very specifically with sex workers. And this is, you can see some of these layers of self-blame for this population. The first one saying, I've told friends that I know about, she's referring to an incidence of sexual violence, and her friends are telling her, well, you need to stop being out on the streets. That's not safe, right? And for her, in that moment, that wasn't a possibility, right? That was what she was doing to get by. It wasn't viable for her to not be trading sex, okay? A lot of them really as well minimize violence, kind of as a risk of doing business. So, and with this is sort of a, just a sense that, you know, nothing is safe. I'm going to be out here anyway. I'm just going to kind of roll with this. A little bit of bravado and also a little bit of minimization of that as well, right? We also heard, this is especially for some of the young women that we work with, is what, you know, she's saying, I ask girls, why didn't you reach out for help before? This is a service provider. And she's saying, you know, they tell me I didn't even know this help was available. So sometimes when we're, you know, doing the work that we're doing at Hopkins and we're thinking about, gosh, we've got these great programs, we assume that everybody knows about them, right? And so this is my enduring message to you, is getting the word out about what's available, especially for groups that we know to be at risk and in need of care. A couple of quotes from some of our global work, colleagues. This is sex workers saying, well, we can't do anything about sexual violence because we'll be reported to the police for trading sex. And if we're reported to police, we'll be prosecuted. So you can see that a criminalized environment is really, really impeding access to justice. Police give me no respect because I'm a Roma, I'm a sex worker, and I'm homeless on top of that, right? And so she has no social standing, she has no ability, in her view, to obtain any support from police. She simply will not be believed, okay? So it's really hard for us to hear this, and it really tells us the work that we need to do, again, to make these, make the things that we've put in place accessible, okay? I mentioned some people are also trying to get some justice outside the system. Certainly through civil society, prevention, sort of bystander response to violence is a place where we think of it generally as prevention, but you could think about it as well as having a justice element. And again, that accountability piece is really important, as we saw in the case example from Baltimore City, really, really following the trail and making sure the accountability is in place, even for the systems that we do have. Thinking about civil society, people may have heard about the Hollaback movement, the power to end street harassment, and this is people being very innovative with, you know, online, sometimes with photos, to really obtain a sense of justice and a sense of validation by simply sharing experiences that they've had. Around, this is very specific to sexual harassment, and you've probably also seen, this is a little bit old now, but you've probably also seen this video circulating where someone wore a t-shirt and jeans and a camera to find out what might happen to them on the street and really record all of the sexual harassment that was happening in this 10-hour span. So this is an awareness tool, but this is also a little bit of a justice system piece, although it's outside the system. These are ways that people have tried to innovate to spread the word about this, as well as have a sense of justice even outside that system. And I think I'm going to end there. I want to leave some time for questions. Do we end at 1:20? 1:20. Okay. Oh, good. Okay, great. I wasn't sure if it was 1:10 or 1:20. So I'll just open it up for questions at this point around really anything that we've talked about. Yeah.
You briefly mentioned it on the slide about gender differences, but I was just wondering if you could maybe talk a little bit, if it's in your area, about the unique challenges of trying to provide services for men that have this issue, just because
Great
it seems like
question.
some of those deterrents would be even stronger.
That is such a great question. Thank you. So so men, and what to do for men that are survivors of violence, right? Some of the challenges are, there are many. Some of the challenges in people reporting, certainly, is for a long time we've thought about this as violence against women, right? So that you can imagine for men that are survivors of violence, particularly sexual violence, particularly child sexual abuse, have made it harder for men to get that support and care that they need. And you can think about layers as well of sort of gender norms, expectations to masculinity expectations to care about yourself and take care of yourself, that would also erode someone's ability to come forward with an experience. So those are what I think of as sort of the barriers to care, to people coming forward for care. For violence victims, and those are really the biggies. On the system side of things, there's been a real challenge in understanding what the needs might be, right? So when we think about the shelter and crisis programs that have been established, I'm going to give you the U.S. history quickly. I think it really started as a grassroots movement, right? And it really started to meet the needs of women that were survivors of violence. And so the package of services evolved, right? And it grew and evolved. And the primary people that were making use of those services, especially for partner violence, were women. And so a lot of times people see, sort of the prevalence estimates for men, and they think, oh my gosh, well, we've got to get equal services in place for men to meet these needs. And there's been a real challenge in figuring out how to do that, because we have a good sense of what women need, in part because that's the nature of the services that we have now. They came in place to meet those needs. And so when we think about simply repackaging those for men, the questions are around, well, what is the need for shelter? What is the need for economic empowerment? And what are some of the needs that men might have that women don't have, right? And so there hasn't been a huge push, I think, in my opinion, to really do a very basic needs assessment, right? And that's what we really need to do, and would help us pinpoint the scope of services, the packaging of those services, and all kinds of things around that. But it's been very challenging, because we do want to be able to meet those needs, but we should not assume that the needs are the same, right? So it's a really important question. Yeah.
I'm thinking about the high-profile gender-based violence things that have happened in the media.
Sure.
With the NFL and other
Yep.
groups like that. Has there been any momentum to try to utilize those events to leverage more prevention, treatment, identification, or anything like that?
Yeah, that's a great question.
Will you repeat the question?
Yeah. Yes, sure. So high-profile media events sometimes really, the question is, do the high-profile media events provide an opportunity for leverage around prevention or other kinds of supports? And the answer is mixed. Sometimes they do, sometimes they don't. Some of the examples that we've seen, particularly from the NFL, have very, very, very much catalyzed a response around early education for young men, for young women, around healthy relationships. Our partners here in Baltimore, House of Ruth, are doing quite a bit of work now that was really very much catalyzed by that. So that's sort of at the professional level. Some of the college cases that we're hearing, people are following the news on this, I'm sure, and are seeing that very high-profile cases are coming out of the of colleges and universities. Those that tend to get the most media attention are where perpetrators are involved in, organized sports. And of course, universities are saying, oh my gosh, we can't, we can't, it gives us cognitive dissonance to have, people that are high performing as athletes, high performing as students, engaging in this incredibly negative behavior. I will share that the incidence, the prevalence of perpetration for athletes is actually a little bit lower than non-athletes at the college level. However, there has been actually a very nice response. In fact, some new policy pieces from, I'm going to botch, I think it's the NCAA, is coming out with some regulation now to make sure that all of their athletes are trained in that, has to be certified annually. And so those are examples of media cases leading to either opportunities and support for prevention or even regulation that is designed to make sure that people are simply getting the education and the training that they need to make sure that they're not perpetrating, they're not bystanding against violence, and to really start to shift the culture that allows abuse to happen. Yeah.
I have a question kind of about, I guess, like good being or perfect being the enemy of good, or however that
Yes.
goes. So I know, for instance, in North Carolina, where there are
Mhm.
rape laws that you're unable to revoke consent and have it still be rape. So if you say yes anytime during the experience, then you can't go back and say no.
Okay.
It was rape. So I was wondering, to the extent that those laws offer some modicum of protection versus how they would stigmatize kind of women's different experiences, and what kind of the net benefit or some of the effects that you would see having, yes, there's a rape law on the books, but we're not it's kind of an ickier rape law.
Interesting. Okay, let me try to summarize your question. The question was around not letting perfect be the enemy of good enough, and a North Carolina law that doesn't allow you to revoke consent. Okay, so right, and just sort of bigger picture as well, we're seeing all kinds of consent, we're seeing all kinds of tweaks. This is especially at the policy level for universities in particular, around language around consent and proactive. Does it need to be proactive consent? Does it need to be absence of, resistance, etc.? And so as these laws are coming out, one of the things that's been really interesting to monitor, and we haven't yet started to do this, is to what extent do people even really realize what some of those nuances are within the legal framework? And I say that in part because universities are also involved in climate surveys. We've got a climate survey coming up at Johns Hopkins. Some of the things that people are starting to ask on these climate surveys are very much in line with what you're asking about, which is, do you know, how much do you know about the policy that's in place here at this university, and how is it affecting your reporting, maybe your behavior, et cetera? So I think the jury is out on that. And part of that is as well because it's an implementation question, and it's sort of a knowledge question. People don't always know all the nuances. Sometimes we hear it and we think, oh, I don't really need to know that, and then all of a sudden you do. And so that's, I think, part of the murkiness around understanding that. Yeah.
Thank you, Dr. Decker.
Oh, yeah.
I have two questions for now. The first is around the fear of social services that you talked about in terms of a barrier to reporting. Do you know of any practices or research around breaking down that barrier? And if police in various jurisdictions do end up reporting individuals who report sexual violence or intimate partner violence to them, do they report them to social services, or is that more of a fear that is sort of unfounded? And then my second question, is around the Violence Against Women Act and birth control, the revoking of the mandate.
Oh, yes.
So you talked about in Maryland, homicide is the highest cause of pregnancy-related death. Has there been, that was a shock to me, has there been any connection between the need for contraceptive and birth control and connecting that to homicide and actual violence?
Great. Two very good questions. Let me try to take them in turn. And I'll talk first about sort of this question about fear of social services and fear of police reporting. So the main policy tool for that is transparency, right? So when we're talking with clients, when we're talking with people about needing to make a mandated report, it's about being very concrete about what's going to trigger a report and what's not. And that's true with our research hats on, it's true with our practitioner hats on. So it's about, for us and for our research in this area, it's about this is confidential, this survey is confidential, this project is confidential, and if you tell me these three things, I'm going to need to take action, even though it may be against your will. And that would be in cases of certainly around child abuse and neglect, et cetera. It's really about communicating that. It's communicating that in the moment, and then it's also communicating it more broadly so that people aren't worried about this. It's not a barrier for them to walk in the door, right? What we find generally is that mandated reporting makes people really nervous, and so there is often a reluctance to really look at exactly where that line is, but it's essential because we don't want that issue to be something that's preventing people from sharing fully their experiences or getting the services that they need. The second question that you raised around birth control and maternal mortality related to violence is really important. Certainly the Violence Against Women Act and what's happening now with birth control coverage are in two sort of separate bins. But what we do know, and we know this from maternal mortality research overall, is that where you have strong family planning in place, you're reducing the total number of pregnancies. And where you reduce the total number of pregnancies, you're always reducing maternal mortality. You're reducing that through unintended, unwanted, mistimed births, et cetera. And so, keeping track of potentially the homicides that could be coming up as a result of changes to birth control coverage is certainly something that, I think would be really important to see. Yeah.
Thank you for your lecture today. Two questions about the transgender community.
Yeah.
In terms of people that are transgender, does the intimate partner violence also the prevalent cause of violence? And number two, does your research allow you to speak about access to justice for people in that community?
Absolutely. Great question. Thank you. Thank you for that. What am I going to say about the first question around prevalence? What the CDC did with the NSFIS, and I encourage you to take a look at it. This is my lead up to the transgender conversation, is they took a look at GLB, but I think not the T. So, of course, the population prevalence of the transgender community is small enough that it's hard to work that into our population-based surveys, right? So anytime you see something like the NSFIS, they would have to really do a lot of oversampling in that community in order to say something, in order to generate stable estimates, right? And so I don't think that we know much about the transgender community through things like the NSFIS. What we are starting to see are reports around certainly violence against the transgender community more broadly. I actually don't know if we have, this is a good question, and please, if anyone in the room is up on this more so than I am, please tell me. I don't know that I've seen something specific enough to intimate partner violence, and I think it may stem from just a recognition that the transgender community is subject to violence from a whole host of perpetrators, and I don't know that we've sort of discerned who are the primary perpetrator groups. And we see that in the sex work literature as well. It's been very interesting with that population because there, of course, you've got intimate partners, but you've got clients, and they're a big perpetration group for sex workers. And so in the early work, there were just questions about violence, and there was this question about but what is that? Is that partners? Is that non-paying partners? Is that clients? Is that police? And so over time, the research has gotten a lot stronger in distilling really who is perpetrating that violence. I would expect the same would be sort of in the coming era for the transgender community, but I don't know that we're there yet in terms of figuring out how much of that violence is happening in partner relationships versus in more community type settings. It's a really important question. Yeah.
So my interest is in children and adolescents. And I'm curious if there's any unanswered questions or gaps in our understanding about the relationship between either sexual assault or intimate sexual violence and sort of mental or physical health impacts later on in life, or
Yeah.
associations or risk factors that then lead to intimate partner violence later in life.
Interesting. Great question. So the question is around child and adolescent populations, and what are some of the unanswered questions in that field as they relate to later health outcomes or even re-victimization? And I think that's a great question. One of the sort of most well-studied risk factors for partner violence is partner violence in the home growing up, right? And so there's, so that gets you sort of the cycle of violence. One of the things that I think is really important in the field for looking at that life course trajectory right now is seeing what are the buffers. What do you need to have in place to have potentially witnessed or even experienced child abuse, but not go on to have intimate partner violence in your subsequent life? And so that's a question around resilience. It's a question around family or other kind of social support structures that you may have in place. We did some work recently with the Women's Interagency HIV study looking at predictors of physical and sexual violence. I should have shared that with you actually. But what we found was that we grouped women into having childhood sexual abuse experiences and a sort of a host of other experiences. And what we found was that if you only had childhood sexual abuse, you were not at risk for sort of subsequent violence. If you interrupted that chain early and didn't have an accumulation of experiences, somehow you were protected from later experiences of physical and sexual violence. If you did experience childhood sexual abuse and you went on to have some other forms of abuse, you were at risk for sort of ongoing abuse. But there was something very interesting in terms of people having had that chain broken, and we weren't able to distill it in the data that we had in the study that we were working on. But I do think that we haven't paid enough attention to protective factors, what keeps people safe, rather than what puts people at risk. So I think, for people that are working in that age population, I think that's a really important area.
Hi. So I had a quick question about, you mentioned support services in reducing re-victimization or preventing. And I was wondering if you can talk about specific services that have been shown to reduce that or prevent it.
Yeah, great. So around re-victimization. So the studies, very interestingly, we can put our epi hats on. One of the real challenges in evaluating programs like crisis programs, actually there's a couple. One is that we know that there are some biases in who comes forward for those services and who doesn't. So it's non-random, right? The other challenge is that, what do you like to do in an intervention study? A gold standard study would take people at a baseline, they give them an intervention, then they study them again, right? And so again, someone's coming forward for crisis services, their opportunity to do that baseline, they're in a state of crisis, they're not able to necessarily complete those forms, or it would be unethical to ask them to do that, depending on the situation. So there have been a lot of challenges in evaluating those types of programs. So it's partly why my list was a little bit short. I should put the studies up there for you to take a closer look at them. But they're generally distilling programs that are either rape crisis programs, IPV crisis programs, or even we included in there, the last time we put this together, we included people who had also had a positive experience of telling somebody and they felt heard, right? And so there's some cohort, I'm trying to think, I'll have to dig up the reference for you actually. But there's some studies that have looked very specifically at women that have have had positive experiences in sharing their experiences of violence, and then looking at some of the health outcomes down the road. And that's also where you see some of the positive mental health impacts, as well as some of the interruptions in re-victimization. That only came out of one study, and I think sort of to this point around like resilience and how do we foster resilience, we've got a long ways to go in understanding what's between, like what's in that pathway, right? What is between getting, support services and having that really impact subsequent experiences of violence. Yeah. Did you have a question?
I think that is.
Oh gosh, we're out of time. Thank you. Oh, before I go, I just will plug, we have a gender-based violence journal club at the school. If anyone is interested, shoot me an email. I can get you on the listserv for it. We meet about maybe 6 times a year. It's really student-led, but it's a great way if you're interested in learning more about this, talking with other students, getting a sense of study design, ethics, etc. And I teach a course in the 3rd term that's very specifically devoted to this issue. So look forward to seeing you around the school, and thank you for having me.